Hello dear Medico student, welcome our YouTube channel The Exploring Medico. I will be teaching your joints. Today we will start from classification of joint. Please like the video and subscribe channel and watch entire series of joint. It is request to all of you to watch entire video so your concept can be clear by this video. You can also make your notes in between. If you have any doubt or question, you can ask in the comment box. In next video, we will discuss about the synovial joint. So we'll start with the joints. What do you mean by joints? The term joints means a place where two things are joined together in anatomical usage. A joint is a junction between two or more bones. Study of joint is called arthrology. So there are mainly two classification of joint. The joint can be classified according to their function and structure. So functional classification, it is based upon the degree of mobility of joint. They are of three types: immovable joint, which is also called synarthrosis; second, slightly movable joint, which is also called amphiarthrosis; and third, freely movable joints, which is also called diarthrosis. So first, immovable joint, which has no mobility. Example for cranial sutures in adults and primary cartilaginous joint in growing children. Second, slightly movable joints, which has some degree of mobility. Example for secondary cartilaginous joint and syndesmosis. And third, freely movable joints, which is also called diarthrosis, in which maximum degree of mobility. Example for synovial joints. So another classification of joint, it is structural classification, and it is based upon the type of connective tissue and the presence or absence of joint cavity. The joint are classified into three types: first fibrous, second cartilaginous, and third synovial. Fibrous joint, which directly unite bone to bone. Single degree of motion means only one degree of movement. Three subtypes: suture, syndesmosis, and gomphosis. Here the bones forming the joints are united by fibrous connective tissue. These joints are either immovable or permit only a slight degree of motion. A fibrous joint lacks joint cavity. The fibrous joints are of three types: suture, in which synostosis; second, syndesmosis; and third, gomphosis. So first, suture. The articular surface are connected by a thin layer of connective tissue, sutural ligaments. These joints are confined the skull. Example for they are peculiar to the skull and are immovable. In growing children, they may permit a little mobility, and its applied anatomy is synostosis. In the elderly, most of the suture of skull undergo ossification, leading to rigid bony union, synostosis. For this reason, the skull of this child is resistant to blow, but no so in adults. In adults, it's become rigid like an eggshell and frequently splinters following an impact. Thus, fracture of skull are much more common in adult than in a young child. So second type is syndesmosis, joined by interosseous ligament, and which has a slightly movable movement is possible in this type. Syndesmosis, these are joints where two adjacent bones are linked together by considerably greatly amount of connective tissue than in sutures in form of interosseous ligament and membranes. Example for interosseous radioulnar joints, interosseous tibiofibular joint, inferior tibiofibular joint. Slight movement is permitted at this joint, which Rotation or radius around aligned movements of supination and pronation. The third type is gomphosis, peg and socket joint. These are specialized fibrous joints restricted to the fixation of teeth in alveolar sockets of the mandible and the maxilla. The root of the tooth is attached to the socket within the alveoli by periodontal ligament. So let's see the diagram in which the types of joints. In first diagram, we can see there are present fibrous connective tissue between the two bones and be cartilaginous. So there are two bones and between the cartilage are present, and in synovial joint there are fibrous capsule, synovial fluid and joint cavity are present in between two bones. The next diagram of syndesmosis, in which a schematic diagram and be inferior tibiofibular joint representing syndesmosis, and it is a diagram of gomphosis. It is a peg and socket variety, and in A diagrammatic representation and B tooth in alveolar socket representing gomphosis. So next is applied anatomy. So periodontitis, in which the gomphosis have a clinical importance in dentistry because teeth becomes loose and may fall following inflammation and degeneration of the periodontal ligament. This clinical condition is called periodontitis. The next is cartilaginous joint. The cartilaginous joint are those joints in which the bone forming the joint are united by means of either hyaline cartilage or fiber cartilage. The cartilaginous joint also lack of the joint cavity. There are mainly two types of cartilaginous joint, in which primary and secondary cartilaginous joint. Primary cartilaginous joint also called synchondrosis, and secondary cartilaginous joint is also called symphysis. So in primary cartilaginous joint, the bones or parts of the bones forming the joint are joined by a plate of hyaline cartilage. Example for joint between epiphysis and diaphysis of growing long bone. Joint between basis sphenoid and basiocciput, it means spheno-occipital joint, and also first costosternal joint. These joints are immovable and mostly temporary in nature. As the growth ceases, they undergo synostosis. Example, plate of the hyaline cartilage is completely replaced by the bone. Next is symphysis, which is also secondary cartilaginous joint. In this joint, the articular surface of bone forming the joint are covered by thin plates of hyaline cartilage, which are connected by a disc or a pad of fibrocartilaginous. Example for symphysis pubis between two pubis bone. Intervertebral disc between bodies of adjacent vertebra. Manubriosternal joint between manubrium and body of sternum. Symphysis menti between two halves of fatal mandible. Not true symphysis. We can see right side of this slide the primary cartilaginous joint, in which A schematic diagram and B primary cartilaginous joint between epiphysis and diaphysis representing synchondrosis, and the next diagram is the secondary cartilaginous joint, in which A schematic diagram and B pubis symphysis representing symphysis. At the last, it is very important note for all of you. Secondary cartilaginous joint typically occur in the midline. All the symphyses belong to the axial skeletal except the pubis symphysis, which belongs to the appendicular skeleton. These joints permit limited movement due to compressible part of fibrocartilage. The term symphysis menti is a misnomer. Now synovial joint will be discussed in upcoming video. Stay tuned. Follow entire series of joint. Thank you.